My name is Sarah Marsico, and I'm a student physical therapist here at Campbell University. Today I'm going to demonstrate how to perform ACE wrapping for a hamstring strain. First, I just want to talk about the hamstring a little bit. So the hamstring is a large muscle on the posterior side aspect of the leg. It has three parts. The most lateral part is the biceps femoris. In the middle is the semitendinosus portion, and most medially is the semimembranosus. The hamstring muscle is a two-joint muscle, so it crosses the hip and the knee. So meaning that at most distally, the hamstring is responsible for bending the knee, and most proximally, the hamstring is responsible for extending the hip, for hip extension. So I'm going to turn back around if you'd like. The hamstring muscle, as I said, is a muscle in the middle, so it's between both the hip and the knee and the ankle as well. So if there's any complications in these major joints, such as the ankle or in the hip, then we may begin to see some issues with the hamstring muscle. So it is not surprising that the hamstring is a common victim of injury. So often a strain or a mild tear will occur in this hamstring muscle, and although there's no strong evidence to support ACE wrapping for a hamstring strain, it is a technique that is often used for exception and compression. The same technique could be used for either the anterior aspect of the thigh as well for the quadriceps muscle if that is also strained. So how we're going to perform this technique, the patient should be standing, and you'll need 2 ACE wraps, unless you have a really long one. So I've got 2 here. The reason we want 2 is because we're not going to only just wrap the upper thigh, or the thigh. We're going to also wrap around the waist, and this is to ensure that if we are wrapping, say, an athlete, we want this to be stable and not to fall off if they're going to go in and play. So having that extra wrapping around the waist will add extra security. So the way we wrap, I'm just going to go ahead and wrap, and then I'll talk it through as I do it. It's a little bit easier that way. So we want to start distally and work our way proximally, and this first wrap will probably just cover the thigh here, and then I'll use my additional one to go around the waist as well. So when we're going distal, when we start distally, you want to pull a lot of tension on this wrap. So pulling nice and tight here and beginning to wrap around. And you can angle up here and then come back, and when you come back around, angle down a little bit so you're getting this overlap. Continue to stretch it. And the goal of this is you want to wrap distally to proximally, and if the tear is in the middle of the hamstring, or this is the quad, or if in the middle of the hamstring, then we're able to keep the swelling from moving. And it is also good to secure the wrapping on the lateral aspect of the thigh, so it's easier to remove and not getting in the way in the adductor muscles. So next we'll apply the second layer, and you can start where you left off, and again, pull that tension. Thank you, Selena. And just make sure that your patient is comfortable. You'll have to talk to them and let them know that where you're wrapping here. And then you're coming around the waist, and this is going to secure around here. Excellent. I know you can't see right now. I'm just here securing. All right. And make sure there's no wrinkles so we're not getting any pinching of the skin or anything. And so this is how you would ACE wrap for either a hamstring or a quad strain. Again, like I said, there's not a ton of evidence to support the use of this to apply for compression or for proprioception, but it is still often used in practice.